The parathyroid hormone itself increases, causing hypercalcemia. And when hypocalcemia causes increase of parathyroid hormone secretion, this is called secondary hyperparathyroidism. Calcium oxalate, the commonest one. Calcium phosphate, most radio-opaque. Struvite, related with infection with E. coli, Proteella, Klebsiella. Cystine stone is familial, and uric acid is radiolucent. So this is the treatment of ureteric stone. Less than 5 mm, medical expulsion therapy. 5 to 10 mm, SWL, and more than 10 mm, ureteroscopic removal of a stone. Hyperparathyroidism. Why does hyperparathyroidism occur with chronic kidney disease or chronic renal failure? Okay. So in chronic renal failure, we know normally kidney try to reabsorb calcium and excrete phosphate. In chronic kidney disease, phosphate cannot be excreted properly, so there is increased level of phosphate. This is hyperphosphatemia. And this phosphate excretion is largely related to a factor called fibroblast growth factor 23. It helps excretion of phosphate. So when phosphate level is increased in blood, it causes increase in FGF23. Okay? So that it can cause increased excretion of phosphate ions from the body. Okay, but this FGF23 has another deleterious effect. What is this? It inhibits the 1-alpha hydroxylase enzyme. 1-alpha hydroxylase enzyme. What is that? This 1-alpha hydroxylase enzyme is responsible for producing vitamin D3. So, reduced 1-alpha hydroxylase enzyme will cause reduction of vitamin D3. And vitamin D3 reduction means reduction of calcium ion absorption from the intestine. So, this hypocalcemia sends signal to the parathyroid gland that there is lack of calcium in the blood. Please do something to elevate the calcium level. And parathyroid gland caused increased secretion of parathyroid hormone. This is called hyperparathyroidism, and this is secondary hyperparathyroidism. Why secondary? It occurs due to effect of calcium, and primary is if the parathyroid hormone itself increases, causing hypercalcemia. And when hypocalcemia causes increase of parathyroid hormone secretion, this is called secondary hyperparathyroidism. So secondary hyperparathyroidism occurs in chronic kidney disease. Okay, and we know that urinary tract is lined by urothelium. Okay, urinary tract is lined by urothelium, the multiple layer of squamous like epithelium. Okay, and when urinary tract stones occur, when there is a stone in the urinary tract, it causes chronic irritation in the urothelium. So this chronic irritation leads to metaplasia, that is squamous change. Friction causes squamous change, and squamous metaplasia ultimately leads to dysplasia, and dysplasia to malignancy. So if urinary stone is present, urinary stone causes which type of cancer? Causes squamous cell carcinoma. Urinary stone causes chronic irritation of the urothelium that turns into dysplastic changes after metaplasia, and that leads into malignancy. So which type of stones occur in urinary tract? We have principally 5 types of stone. So urinary stone, number 1 is calcium oxalate. This is the most common. Number 2 is calcium phosphate. Number 3 is struvite stone. Number 4 is cystine stone. Number 5 is uric acid stone. And just to know a few words about each of these stones, we have all read it during our part A examination. Calcium oxalate is the commonest. Calcium phosphate is the most radio opaque. Struvite, also called staghorn calculus, is related with the infection. Cystine stone occurs in family, right? Familial predisposition, and uric acid is radiolucent. So you must have to know these 5 stones with these 5 criteria. Calcium oxalate, the commonest one. Calcium phosphate, most radio-opaque. Struvite, related with infection with E. coli, Proteella, Klebsiella. Cystine stone is familial, and uric acid is radiolucent. So what are the treatment option of the stones? Treatment option for ureteric stones, if less than 5 millimeter, we do go for medical expulsion therapy or expectant management. That is medical expulsion therapy with hydration, antibiotics, analgesic, or adrenergic blocker. We expect the stone will be passing out through the urine. If it is 5 to 10 millimeter, we go for lithotripsy, that is ESWL. And if it is 10 millimeter, we go for ureteroscopic removal of stone. So this is the treatment of ureteric stone. Less than 5 millimeter, medical expulsion therapy. 5 to 10 millimeter, SWL, and more than 10 millimeter, ureteroscopic removal of stone.